Hi, my name is Bob Funk. I'm a student at Moraine Valley Community College. I'm here today. I'm a student of massage therapy. I'm here today to teach you about the condition or the pathology of pes planus and how massage can alleviate the symptoms of pes planus and even restore function in the foot. So, what is pes planus? Pes planus is fallen arches or flat feet. It's a decrease in the longitudinal arches of the feet. The feet have three longitudinal arches, two longitudinal and one transverse. Now, if you look at this diagram, this is a diagram of flat feet where the bones are lying against the ground or the surface, and a natural arch, which is a normal arch. You can see the arch is curved. It's an arch. So when you there's several causes of flat feet, which flatten the arch as indicated in the diagram above. Some causes of pes planus are poorly developed arches during the growing years, standing too long in one place, like for a job, like a factory worker, uh, obesity, uh, and poorly footed footwear. One chiropractor in Ohio said this about the poorly fitted footwear. She says, children whose weight is perfect can also have flat feet. Uh, a common problem is footwear. Most kids are wearing flip-flops, Crocs, Uggs on a regular basis, none of which provide adequate support for their growing feet. Dr. Hartman says such footwear may be cause for concern because of the possibility of future ankle, knee, and hip problems. So with that being said, what are the biomechanics of the arch? So when you walk or run or stand, uh, this is the foot, and here's the arch here. If you hit the ground, it it comes up, and if you have a flat arch, it'll hit the ground, and there'll be no absorption, shock absorption. But if you have that arch, the arch uh, uh, sucks up all that absorption, and you're and you have no pain. So that's the function of the arch. But when you have that flat feet, that's shock absorption is lost. So when that shock absorption is lost, it creates pain. So the absorption, the shock has to go somewhere. So it's going to go up the kinetic chain. And the kinetic chain is your joints. It starts from your feet, your ankles, and it goes all the way up to the midsection in your spine. So you're going to have that shock is going to go to the ankles, it's going to go to the knees, and it's going to go to the hips, the joints of the hips, and then the lower back. So that's where the pain is going to come from, because the fat feet cannot absorb that shock, and it presents itself in those areas. So you're going to have a pain. So how do we alleviate that pain? That pain is alleviated one way by orthotics, and this is an orthotic, a shoe insert that is an artificial support, uh, artificial arch. So it supports that and creates that, so you can have shock absorption, so you don't have any pain. But there is a better way. Uh, why not massage? Massage can combat that laxity that the orthotics promote, because the muscles aren't working. It's just providing an artificial support. So we can combat the laxity. We can promote active soft tissues of the foot in that medial arch, and the connecting muscles in the lower leg, like the tibialis anterior, the peroneals, the gastrocs. Pretty much all the muscles can be massaged, and we can alleviate the pain that's caused by fat feet. by massaging, we can alleviate the pain, we can promote flexibility, and the range of motion lost because of bad biomechanics, like which is excessive pronation. When you don't have that strength in the muscles of that medial arch, you're going to excessively pronate, which is induced by the flat feet. So if a person comes to you with lower chronic back pain or knee pain, a massage therapist should look at the feet to help restore the arch function and to mitigate the pain up the kinetic chain. There's different exercises that you can do that can help strengthen and alleviate that pain and loosen up those and reactivate the muscles in that medial arch. You can take a lacrosse ball, a tennis ball, and those have different textures and you roll the ball on the top of the foot, and you strengthen those muscles. You gotta use the muscles, or you're gonna lose the function that they provide. I hope this video is helpful in learning about pes planus, its causes, and how massage can help. Massage is a conservative, inexpensive, and viable option to alleviate the complication from pes planus. I hope this video is helpful. Thank you for your time. Thanks.